Hello, my name is Sydney Mershimer, and we're going to talk today about one of the most underrated things in healthcare, care coordination. Care coordination is one of the most basic and overlooked parts of nursing. Nurses keep care coordination in check. They make sure doctors do what is appropriate for the patient and patient care. Making sure the patient has appropriate help when they go home to any facility, any prescriptions they may need, or any supplies like a walker, cane, etc., is all the nurse's responsibility to oversee. The nurse should always be the patient's biggest advocate. When collaborating with families and patients, one of the most important things is patient comprehension. Some patients are not literate, so the way we teach is vital. If a patient has difficulty reading of any sort, a teach-back or demonstrative method has been shown to be most effective. Discharge education begins on admission. When patients are disgruntled or upset with a diagnosis or are very acutely ill, they will be less receptive to teaching, as opposed to only hearing discharge and follow-up instructions once at the time of discharge. The patient will hear it repeatedly, which will make a change in their understanding. For a literate patient, a good resource is a printed out handout with any new medications on it. The handout will show drug interactions, side effects, dosages, and when to call the doctor. This is such a great resource because the patients can take this home with them and reference them from home. This can help prevent any medication errors and give the patient reassurance as to why they are on this medication. Another collaboration technique that should be used is giving the patient an options should they have to attend a skilled facility or even change their residence to a nursing home. Having such a large change in their lives can be stressful, especially with a new diagnosis on board. One of the most important jobs of care managers is to make a list that patients can go to and let them choose. Their decision does not have to be based upon any one factor. They could choose a place where a loved one was previously cared for, or just by simply choosing any random one off of a piece of paper could help. The care manager can look into the preferred areas for the patients too. It does not have to be a certain distance of the hospital. Once a patient makes a decision based upon where they would like to go, they attempt to get an authorization from the insurance. The care manager will then go back to the patient and let them know of any out-of-pocket costs or any other fees associated with going. On the other hand, if the patient is deemed okay to go home, they must evaluate to ensure safety. Physical and occupational therapy will evaluate the need. If the patient is going to their home for home equipment, such as bedside commode, walker, cane, and any other ambulation device, the doctor will consider the need for visiting nurses at home. These are great because they can do wound care, check up on the patient, provide any knowledge they may have left the hospital without. Coordinated care is so important because it ensures patient safety both in and out of the hospital. Inside of the hospital, it helps to be sure the patient is receiving care in a holistic way. Having the nurses look at the big picture really helps when there are smaller problems in addition to large ones. I work in the ICU, the intensive care unit, and oftentimes when a patient has one really pressing matter, doctors and other staff seem to focus solely on the big problem, but there are small problems present that also need attention. Care coordination is also about ethical decision making. Giving families a choice is great in theory, but sometimes the decisions that are made could be unethical. For example, if a patient voices that they do not want a tracheostomy and a PEG tube, but then suddenly they decline in health to the point where they are no longer able to make their own decisions, but the family decides that they want the tracheostomy and the PEG tube placed, because they are not ready to say goodbye. That is clearly against the patient's wishes, and a consult for ethics would be appropriate. It is the ethics team role to decide what is ethical and what is not. It is only the nurse's duty to place the consult. When considering what aspects of change management directly affects the patient experience, there are a couple. First and foremost, the employee's perception of change will directly impact the patient experience because the employees are the individuals having direct patient care. When implementing a change, a good model to abide by would be Lewin's change model. It has 3 separate parts: unfreeze, change, refreeze. Unfreezing is determining what change is needed, ensuring there is a strong leadership in place, creating the need for change, and being able to understand the doubts and concerns from staff. Change is when the actual change was identified in the unfreezing. Key components of the change phase are communicating often, giving empowering actions, and making sure everyone feels as though they were involved with the process of the change. Finally, the last step is refreezing. This is when you sustain the change. Make the change part of the pre-existing culture and celebrate the successes when possible. This change model is incredibly helpful when introducing a new change because it allows employees to feel validated by allowing input, communication, and involving the employees in a new change. Another important aspect of change management that directly affects the patient care is, why are we making the change? Are we making the change because the corporation wants to save money? Are we changing because we want to make a process involving patient care more efficient? The why behind change is just as important as change itself. Changes that are made strictly to save the corporation money are not typically beneficial to the patient experience because they are not done for the right reasons. This can also lead to negative staff backlash who have the patient's best interest in mind. But change is made for the right reasons, the right way, can lead to high quality, patient-centered care. An interesting policy provision that was enacted in the European Union, they implemented policies concerning the provisions of diagnosis, care, and cures to ill people along 3 tracks, including the European Union public health policies concerning the well-being of all people, the application of the free movement principle to national healthcare systems, and stricter surveillance of the budget. The application of free movement principle relates to the Europeans' right to cross borders to receive health care. This is helping their economy while they are in a debt crisis. But Europe is understanding that patients still need health care where they may not be able to afford it in Europe at this time. This policy provision was made in the interest of the patient and is a very understanding provision. Even though Europe made this provision, they still are currently have a healthcare union emerging. All in all, the most important thing is the patient care. The patient should always be considered, especially their best interest should be put first. If it is not, that is where ethical dilemmas come into play. As healthcare providers, we should always have the patient's best interest in mind. Changes also could be made to improve the patient experience, but with input from the staff to make patient changes go as smooth as possible. Focusing on care coordination basics will ensure the best possible patient experience, both in and out of the hospital. So next time, don't skip the coordination step. Make sure you're talking to all of your available resources, including doctors that are consulted, skin and wound team to help the patient at home, making sure they have home care set up if they need it, making sure that the patient can go back to the quality of life they came from, and we need to give them as many tools as possible to be able to sustain this. Thank you.